There's a little known phenomenon happening on the US southern border that's contributing to the increase in COVID cases nationwide. We're going to talk to Todd Bensman about it on today's podcast.
This is the Hot Zone. Engaging with the news in a whole new way, international war correspondent Chuck Holton brings insight into areas of crisis and lets you help those affected.
Hey folks, thanks for watching the Hot Zone. I'm Chuck Holton, and today we're going to talk to my friend Todd Bensman from the Center for Immigration Studies. He's been doing some research on an outbreak of COVID cases right along the U.S. southern border that you probably haven't heard about in the news. Todd, thanks for being with us.
Good to be here, Chuck, always.
So give me a sense for what you are finding about what's going on the southern border.
Well, first of all, there's a big, gigantic clue about what's been happening on the border. We have super dark red hot spots all along the border from Texas to California. The clue about where what the origins are for the hot spots lie in big media reporting from about a month and a half, 2 months ago, which holds that very large influxes of people who are infected in Mexico are fleeing that country's overwhelmed hospital system in order to get to U.S. Hospitals, particularly in California and Arizona, and I mean by the thousands. Now, this is according to early New York Times reporting, Washington Post, the Wall Street Journal, talking about very large numbers of Mexican visa holders, green card holders, and some American expatriate retirees who were living in Baja and Sonora who got infected in Mexico because their curve is a little bit behind the US curve. So they were peaking as our numbers were appeared to be under control. Those hospitals are in a terrible state. People dying in the hallways without ever even being seen by a doctor. People who are having heart attacks and getting in accidents, having no care because those hospitals all along the northern border in Mexico are completely overwhelmed and overrun. So if you get sick down there and you have even the slightest chance to get over the US border, which is technically closed for the most part, you're going over the border through a port of entry and having an ambulance meet you.
I was going to ask you, what is the situation as far as being able to cross that border right now? I thought that the ports of entry were closed.
So the ports of entry are closed to everything except non-essential travel. But if you have a need for medical attention, that's regarded as essential. So there's a little bit of a loophole there. And especially if you're a US citizen, you're allowed to come over without any kind of delay or quarantine or anything like what's going on the northern border. And if you have a green card or you're a dual citizen, Mexico and the US, you can cross right over the border under a whole variety of loopholes. So it's not really closed. And they're coming over in very large numbers through the California ports of entry and the Arizona ports of entry, according to those early big media reports. Now, those reports did not anticipate that we would have a second spike going on in the United States. And so those media organizations never refer to their own reporting again. That's from mid-May and early June. So they will not talk about those influxes coming in from the border now. Texas has since spiked. We have thousands and thousands of new cases in tiny communities along the Texas border that appear on their face to have no plausible explanation based on local populations, except that people across in sister cities in Mexico are finding the same clogged up, overrun hospitals in Mexico. So there's been not very little reporting about the Texas situation, which is really leading the nation's spike, and especially the Texas spike. Same with Arizona and same with California. So what really does appear to be an influx of what I call COVID refugees coming in from Mexico and filling our hospitals. Now
So
they're not,
just to be clear, these are not necessarily illegal migrants that are jumping the fence or anything like that. These are people that have a green card, have residency of some sort, or have some loophole, some way. Like basically, if you live in Mexico and you have any possible way of getting into the United States, you're going to take that way if you start to feel sick.
yeah, that's definitely happening if you believe the Washington Post, the New York Times, and the Wall Street Journal, who all sent reporters to the border a month or two ago. But in my own reporting, I've been told by Border Patrol sources here in Texas that there also are quite a few illegal aliens coming in between the ports of entry who are extremely sick. One just last week, story recounted to me, a woman came over just about unconscious from COVID. Uh, Border Patrol on an ATV and by horseback got her, called an ambulance, put her on the ambulance and shipped her to the hospital. There have been many Venezuelans, Cubans, Ecuadorians, non-Mexican, and also some Central Americans who also have come in uh, complaining of illnesses, and Border Patrol is obligated under current policy to take them to a U.S. hospital. So they're
Yeah,
getting free.
I heard from our mutual friend Carlos, who was with us in January down in Guatemala, that the caravans from down there have restarted. Now, they dropped off tremendously in the first part of the COVID crisis, but there were still a pipeline of people that were backed up, if you're, I'm sure you'd agree, all the way down into Colombia. And that pipeline of people was made up of Africans and Middle Easterners and all sorts of people that have been stuck for months, that now we're getting reports that they're just saying to heck with it, and they're just starting to flee north again to the United States.
Well, those people are going to find or should find obstructions at various borders between there and here. For one thing, you've got the Mexican National Guard, I believe, are still in place and have turned back prior caravans, but also the Hondurans have gotten sort of tough, and the Guatemalans have gotten a little bit tough too. And I think they're just testing the perimeter, uh, kind of probing for weaknesses. And if
Right.
they find one of the weaknesses, they'll be right up to the U.S. border. Most of those extra continentals, non-Mexicans, will probably be let into the United States under various loopholes, and spend some time in U.S. detention facilities. Before they get into the detention facilities, as part of their admittance, though, they're being tested for COVID, and quite a few of them are testing positive, I'm told by my ICE sources. So
Right. So that's obviously kind of wrecking the curve when it comes to the numbers that we're seeing in the United States. I know that the United States has been exporting, has been deporting quite a few Guatemalans and Hondurans back to their home countries, and some of those have been COVID positive, which has not helped our relationships with those two countries. Do you think that might cause Honduras and Guatemala to sort of look the other way when those caravans kind of move on through?
the the caravan movement and the movement of migrants generally, the obstruction of that movement is entirely to the whim of whatever president or political party happens to be in office at any given time, there and also here in the United States. Right now, you've got Trump really, twisting arms in Mexico and Guatemala to sort of help us out with this, or there'll be consequences. In a couple of months, if the White House turns over, those kinds of threats and that kind of arm twisting will go away.
Mm-hmm.
So you can expect, if there's a changeover in the White House, you can expect a full-bore, full-fledged migrant crisis at the southern border. That's what I anticipate.
Yeah, I mean, whether or not there's a COVID crisis, I think that'll happen if Joe Biden's our next president. Now, President Trump, as you know, recently met with Manuel Lopez Obrador, the president of Mexico, and it seemed that those talks went well at the White House. Uh, what have you heard about what went on in those talks concerning this issue? Was it even brought up?
It was. They came to an agreement to extend the so-called border closure between the two countries and to extend that for another month or two. It's been renewable since March 20th. But my view of the quote unquote border closure is that I put it in quotes. For one thing, it's really to stop people who have recreation on their mind from going into Mexico to drink and party or whatever. But the border is still pretty much open for shopping and commerce of all sorts. People can come and go under the closure. Commerce is still coming. There's really not much of a closure, and I think one of the problems with the setup and the arrangement right now is that there's no quarantine period for either side like there is in Canada, which has a far fewer number of cross-border travel between the two countries because of their 14-day quarantine. There's really nothing keeping people coming and going. We don't investigate when some Mexican citizen who's got a visa comes over and says, I'm an essential worker or I'm essential in some way. We don't investigate, we wave them through.
Wow. So pretty much anybody that's got a green card or whatever can say that they're essentially, and we don't investigate that. Would it, I mean, obviously it would be helpful if we did institute some kind of 14-day quarantine for people coming into the country, don't you think?
Well, I mean, for one thing, we have to acknowledge that there is cross-border COVID refugees coming into our hospitals. We don't know how many. We've got pretty good credible reporting that it's happening in large numbers. So large, in fact, that California, in order to keep its border clinics clear, had to institute a helicopter airlift to day after day after day move patients to Sacramento and Riverside and to other hospitals in California's interior where they're getting counted.
Wow. I'm sure that's cheap. That doesn't cost anything.
Yeah, I think somewhere around $40,000 a pop. It's all going to the California taxpayers. But there are a lot of people coming over, and if we don't acknowledge that that's happening and then try to get a handle on how big of a problem it is, nobody's going to make a move to fix this border problem and slow that down.
Yeah.
That is a major public health crisis in the making. It's certainly not helping anything to reinstitute bar closures in McAllen, Texas, if they're all coming in they all got infected in Mexico and they're coming over. It doesn't, the things that our governors and mayors on the border are doing don't apply to the situation, because if they got infected in Mexico under Mexican circumstances, doesn't help us a bit. We need to know how many are coming.
Do we have, I believe that we issue about 1 million green cards a year to Mexican nationals. And I'm sure that, I mean, who knows the total number of green cards in the United States, but I mean, just Mexicans alone, you're talking about millions of people. And so obviously that is going to have a major effect. Well, that's all the time we've got for today. Todd, thanks for being with us again. We always love having you on the show. Your reporting is some of the finest out there, without a doubt, and it needs to get more publicity. So let's hope more people will like and share the podcast with your friends. You can get it on YouTube for video, or Podbean or iTunes for audio. If you want to support the podcast, you can go to patreon.com/hotzone and subscribe for just $3 a month, or you can go to victormarks.com/hotzone and your donations there will be tax deductible. Anyway, thanks for being a part of the Hot Zone. We'll see you again in a couple days. I'm Chuck.
All right, keep doing what you're doing.
The Hot Zone is produced by Amy Holton and Livefire Media. Copyright 2019.